How is ALS diagnosed?
Sadly, we're still diagnosing ALS in much the same way as the first person who described it in the late 1800s. We get a certain story, a story of gradual onset, progressive weakness that spreads across the body without a lot of pain or sensory loss. We see certain things on our exam, what are called upper motor neuron signs and lower motor neuron signs. Upper motor neuron signs include spastic muscle tone and hyperreflexia, and lower motor neuron signs include things like muscle atrophy and muscle twitching and weakness that we can easily demonstrate at the bedside. We do a test which is called an EMG. It's a test that involves electric shocks and needles getting stuck into muscles, and that confirms that there is a problem with motor neurons. And then we do testing to rule out mimics. That's usually a combination of imaging and blood work to look for rare but potentially reversible mimickers of ALS. The whole process takes some time. In general, between symptom onset and a diagnosis of ALS, in most parts of the world, it's more than a year that goes by. It's really problematic for a lot of reasons. One, because people are getting worse. They're becoming more disabled, and they don't have an answer as to why. They may be missing days of work. You can't get any sort of disability income if there's no diagnosis. It's a problem because people are often getting treatments for diseases they don't have. Like about 15% of my patients have had an unnecessary surgery on their way to an ALS diagnosis. It's a problem because if what I'm trying to do is preserve someone's function, by the time they get to me, most people have lost about half of all their motor neurons. It's a bit of a question as to where those tests would be used, though. Like the way ALS typically goes for a person is for the first month or two, they're not even sure anything's wrong because this starts so gradually. It's not like a stroke where you wake up and half your body's paralyzed. So most people are not going to be running down to CVS to get an ALS test, like a COVID test, because they're not sure anything's wrong. And then they go see their primary care doctor. Since I'm married to one, I know how they think. They think about common things, and that's what they should be thinking about. And since ALS is not that common, they're not thinking about it. They're thinking about things like a pinched nerve. So they typically will treat the person with anti-inflammatories, maybe some physical therapy. A couple months go by, person comes back, they're getting worse. Now the primary care doc usually gets pictures, typically x-rays, maybe CAT scans or MRIs, usually of the spine. Those are almost always abnormal as we get older. And so that might prompt a referral to a surgeon. If it's a good surgeon, they recognize right away, hey, this doesn't really make sense for a pinched nerve. There's no pain, there's no sensory loss. The abnormalities on the spine don't really explain the pattern of weakness. If it's a bad surgeon, they just operate. And again, 15% of people that I've seen have had unnecessary surgeries, very often spine surgeries, on their way to an ALS diagnosis. That delays things even further. Finally, they might get to see a neurologist. That's typically 7, 8 months in. The general neurologist that they usually see first is typically pretty good at localizing a problem. They often write in their notes, this looks like a problem with motor neurons, could be ALS, but they don't usually have the conversation with the patient. And I think there's probably a couple reasons for that. One, they might not be that confident since it's a rare disease. They might not want to open that door until they're more sure. But two, I think there's also a time issue. Like you can't just waltz into the room and say, I think you might have ALS. I'm sending you this guy at Duke. Take care, and walk out. That's not going to work. You're going to get a lot of questions. There's going to have to be a conversation. And most general neurologists probably have 10 or 15 minutes scheduled for that patient. That's not enough time to really break the news and answer questions. So, they refer them to somebody like me. By the time people get to me, I don't need that test. Like I can already do the diagnosis the way it's always been done. When you think about all the people that came before me, the only person that might use that new test would be that general neurologist. So if it's a confidence issue, that test could help them. It could maybe cut a few months from the diagnostic delay. On the other hand, if it's a time issue, they're not going to want to do that test. Because again, you can't just do that test and have it come back positive and waltz out of the room. You're obligated to spend some time with that person to explain it. So I don't know. I look forward to seeing what happens if we get a new diagnostic test. I hope it shortens that interval, but I'm not sure that it will.